Welcome to EJB Talks, Rutgers Blaustein School experts in policy, planning, and health, where we talk with our faculty and staff experts, as well as students, about how the fields of public policy, urban planning, public health, health administration, and public and urban informatics affect your lives. Welcome to EJB Talks. I'm Stuart Shapiro, the interim dean of the Blaustein School, and the purpose of this podcast is to highlight the work my colleagues in the fields of planning, policy, and health are doing. We're spending our 8th season, meeting with our new faculty here at Blaustein, and we have a lot of them. We hired 10 people over the past year in a wide array of fields, as this season will show. Today, leading off the season, we are talking with the new director of our health administration program, Professor Ellen Kurtzman. Welcome to the podcast, Ellen.
Thanks, Stuart. Thanks for inviting me. Really appreciate it.
So, I generally like to start these by talking about people's origin story. How you have an interesting background, and you, like me, you've moved in different areas over the course of your career. How did you move from policy to nursing and now to health administration?
Yeah, it's actually a really interesting story. The order is a little bit different. I went from nursing to policy to health administration.
Okay.
I started in nursing. It was sort of a good fit for me. I was in high school and always thought I would end up in the sciences. I wanted an active career, and so nursing seemed like a really nice path for me. But it turned out I was a pretty lousy nurse. I actually am really I'm really
I was a bad engineer in a prior life, so we have
well,
that
there
in
you
common.
go. We have that in common. Yeah, no, I'm really uncoordinated. And when I was a very new nurse, this is the true story. I stuck myself with a contaminated needle and I
Oh
got a
dear.
really, really bad case of hepatitis.
Oh my
And
gosh.
I was sick for a year. Luckily, I was still living at home. I had moved back to my parents' house because I was, hepatitis is like a really bad case of mono. So you just
Wow.
sleep every day, all day. Took me a year to get healthy. And as I was getting healthy, I thought that was a pretty big sign that maybe nursing wasn't the best fit for me. And so I sort of went about my business trying to figure out what I could do with a health degree, with a clinical degree that wasn't nursing. And I ended up doing health education work. But the health education work I ended up doing was for an organization that was trying to communicate to its members in association new policies that had gone into effect, new federal and state policies. And so that really translated me from sort of a clinical side to a policy side. And that was really very interesting to me. So I spent about 10 years working in health policy, in and around health policy, spent some time working on Capitol Hill and in the administration. That was really interesting. And then, I decided to pivot. I had ended up in academia and decided to pivot. And that pivot was to health administration. And that really came about because most policy that affects nursing is hospital policy. It's administrative policy. And so it feels very natural to be in a program where we're teaching students about health management and health administration, because that's the sort of policy that influences nurses and the people who work and occupy the hospital and the other health settings that health administrators work in. So it's really been a pretty natural progression, except for the hepatitis.
Yeah, no, I
Yeah.
tell people when telling my own story that every step along the way made sense.
Right. Yeah.
So as you've made this progression, what sort of commonalities have there been in the fields that you've traversed there?
Yeah, well, my interest, my research interest, and my clinical interest really is how to use policy, how to use practice, how to use the people who work in healthcare to get a better product, to get a better healthcare delivery system and a better healthcare experience. And so everything I've done, whether it's in trying to influence policy or whether it's conducting research or whether it was when I was actually at the bedside for the short time I was, it was really to improve the experience in the delivery system. So that I think that's the common thread through all of it.
So that does lead naturally into my next question. Just this morning, I was having to explain to someone what health administration was, and why Blaustein does it. And so, let me get your impression after 6 months here. What is the field of health administration, and how do we teach people to be health administrators?
Yeah, so to me, health administration is really the intersection of healthcare delivery and business. So it's really the aspects, the management and administrative aspects that govern our healthcare system and the delivery system in which healthcare is delivered. And we teach health administration just like we would teach healthcare management. It's a management degree in a healthcare setting. So it's business, it's financial aspects of health administration and healthcare delivery. It's about the accounting. It's about the marketing. It's about the human resources. Those are all aspects of health administration.
So, what is different about teaching someone health administration than sort of a typical business administration degree? What do they have to learn that they wouldn't learn in an MBA program?
Yeah, well, first of all, the product is different, and the product is a people-oriented product. You're taking care of patients, so patient experience becomes a really important factor in the delivery system. And so, all of the aspects that have to do with improving that experience, whether it's a financial experience for a patient or whether it's improving the quality of care, which is a big focus of our program, whether it's making the system more efficient so that overall the system is saving money or at least not costing anymore. It's about the supply chain, all within a healthcare setting, and all people are not a laboratory, so people change the product and the output considerably.
Gotcha, gotcha. Well, I want to make sure we talk about your research. I want to do this with all of our new faculty because it's such a wide array, as I said, of different areas of research, and it's really going to broaden sort of the kinds of things that the Blasting School does. So you've been working on marijuana legalization, which is a hot issue here in New Jersey as well as other places around the country. Tell us about what brought you to that as a topic area.
Yeah, so I think that's an interesting story. And then I was working in the administration. I was working for the former Surgeon General, Jerome Adams. That was a big, sort of substance use was a big part of his platform. He had, some personal experiences in his family with substance use and substance abuse. And so was really committed to bringing the nation along in terms of their understanding of substance use and substance disorders. And so marijuana use became part of his platform in that he was trying to warn the American public, mostly pregnant women and young adults, about the use of marijuana because in the developing brain, there is some evidence that it can cause some harm. So his platform was really communicating to the American public about the hazards of marijuana use among pregnant women and young children and adolescents. And I became really fascinated with what was happening across the country, where we have this sort of patchwork of states, some which are legalizing for medical use, some which are legalizing for recreational use. And of course, that creates an experiment in and of itself, that laboratory of what happens when a state goes from in illegal status to a legal status. And so I became really interested in how that legalization, whether it was for medical use or for recreational use, affects the healthcare delivery system and the people who are seeking healthcare in that system. And so for the last few years, a lot of my work has focused on what happens in states that legalize and what it means to our healthcare delivery system. Right now, I'm working on a study that looks at marijuana use disorder prevalence in emergency departments after the legalization of marijuana for recreational use. And you would expect that marijuana use would go up, and so marijuana use disorder would increase. And that's the hypothesis we're looking at, whether or not in states that legalize, there's more marijuana use and more marijuana use disorder.
And what is marijuana use disorder?
I knew you were going to ask me that question. Marijuana use disorder is when a person who's using marijuana can't stop using despite it affecting their health or social, circumstances.
I see. Okay. Yeah, I mean, one of the great pleasures of doing research in the United States is we often, in 50 states, have different conditions and allow us as researchers to take advantage of those natural experiments that occur when different conditions and different policies hold. So,
That's exactly right. Yeah.
what do you talked about your hypotheses, if you had to guess where this work was going to go, what you were going to find, and what the implications for policy and for health administration were, what would you guess?
So, I would guess that we'll see an increased prevalence of marijuana use disorder in states that have legalized. And I think what that suggests on the policy side is they may want to include policies when they're legalizing to make sure that certain populations have warnings, or there might be other elements of the policy that deter people who are likely to be substance use disorder patients from access to it. On a management side, I think what it tells us is that patients in the ED, in the emergency department, may need to be managed quite differently if
Mhm.
they're known marijuana users, or if we know that they're suffering from marijuana use disorder.
So, if you were advising a state about legalization, would you advise against it? Would you advise doing it carefully in the manner you described?
Yeah, I think states are going there. I think
Right.
that the tide is turning and it's just sort of happening. And so, what I would say is careful consideration of the implications for high risk populations, pregnant women, young children, teenagers, people who are prone to substance use disorders. For those populations, I think the states have to be really careful about warnings, providing education, making sure patients understand the implications of use disorder. So I think states are going to do it, and it's just how carefully they're going to proceed.
Right. I mean, hopefully there are lessons both good and bad from tobacco and alcohol out there in terms of what we should and shouldn't do as we move
That's
into
right. I
marijuana.
mean, I think what's really interesting with marijuana is, potency has changed so tremendously over the past few decades.
Hmm.
And unlike other substances, there's no way to sort of quantify how much of a dose somebody's getting.
Hmm.
And so it becomes really, it's hard to regulate something that you can't quantify in the same way.
Yeah, no, that's right. Not the pack, not the bottle, not those kind of
That's
things
right.
that we have with cigarettes and alcohol and
That's
such
right.
there. Okay, that's fascinating work. Before we let you go, though, I do know that the Health Administration Program has some events this year, this semester, and wanted to give you the chance. You're leading off, so you get the most lead time in advertising them. What do you got going on this semester?
Oh, that's great. Yeah, so in April, we have a fun-filled and packed April. We'll be holding a symposium. That symposium sort of unites the pharmaceutical industry and the healthcare delivery system. We're going to look at how pharmaceutical industry and hospitals and health systems work together on innovation and drug discovery. And then we'll be holding an event about the Cullen case. And if you remember, there was a nurse many years ago who actually murdered some of his patients. And so we're going to take a look at that case, what lessons learned for the healthcare delivery system and health administrators. I mean, how we can prevent those kinds of events from happening ever again. And I think there are some real lessons for health managers and health administrators and how to detect those kinds of problems and prevent them from happening. So those are the events we're having. It's going to be a fun-filled, packed April.
As interim dean, I cannot tell you how happy I am that you said we're telling people how to prevent those types of events rather than how to perpetrate them. So thank you very much for coming on, Ellen. It's been a great
Sure.
conversation.
Same here, Stuart. Thanks for having me. I appreciate it.
A big thank you, in addition to Ellen, to our production team, Amy Cobb and Karen Olson. We'll see you next week with another talk from another expert from the Blaustein School. Until then, stay safe.